Welcome and thanks for joining us. My name is Emily Spranger, and I'm the Associate Director of Endowed and Gift Planning here at Grand Valley, and I'm excited to join my colleagues in Alumni Relations for today's webinar. Today, our webinar is on Medicare, and it's the first in a monthly series that's called Retire Well, which brings you an array of helpful information as you prepare for or embrace retirement. Just a few housekeeping notes before we get started. If you ask a question at any point, please use the Q&A box to send those to your presenters. It should be at the bottom of your screen next to the share button. But again, that Q&A box will go right to our presenters. And during the webinar, we'll drop some helpful links in the chat as we go along, and we'll share some additional information in a follow-up email as well. So we'll get started, and I'm pleased to introduce our two speakers, alumna Melissa Stewart, to facilitate today's presentation, along with Michael McEntire. Welcome. And Melissa, I'll hand it off to you.
Great. Well, thank you so much. I appreciate that. I'm going to go ahead and share my screen, and hopefully my tech works like I want it to. Full screen. All right. So thanks so much for taking the time to join us today. I have had the privilege of offering this presentation now for over 10 years, been doing the Retire Well series. We really came together with some human resource departments that were saying, you know what, we have a lot of people who are thinking about retiring soon, and we want to set up a course for them of a series that they can take that can help tee them up for retirement. There's a lot of questions around Medicare and around Social Security and estate planning. So that is really what birthed this series over 10 years ago. And I have had the privilege of working with Michael now for about, I don't know, we're probably going on 5-6 years, Michael, I want to say.
Yep.
So know Michael very well, know his team at Voyage Benefits very well. And I just want to start by saying that I'm a financial advisor. So I work with Clear Vista Advisors. I started Clear Vista 4 years ago after being at Raymond James for 10 years and other financial institutions before that. And at Clear Vista Advisors, we specialize in working with retirees mostly. So that is kind of our niche where we're really helping those thinking about retirement do the financial planning and help them transition into retirement. So with that, I just wanted to point out a couple things for you. This is just a sneak peek at our financial planning program, and in there we put healthcare costs as part of that goal. And Michael's going to go into a lot of detail about this today, but we're planning for how much is his healthcare going to cost, how much is her healthcare going to cost. That price changes based on whether you're using a Medigap policy or a Medicare Advantage policy. We're also inflating the cost of healthcare faster than the rest of the goals that you have in retirement because we know healthcare costs inflate on average right now about 5% a year. So if you're not already working with a financial advisor, I would highly encourage you. You're more than welcome to reach out to me at Clear Vista Advisors. I'd be happy to walk you through a financial plan, but you should definitely be budgeting for some of these costs as part of your financial plan. And then lastly, before I pass this over to you, Michael, I wanted to mention that this is being recorded. And if you just Google GVSU Retire Well, you'll get to this page and the resources will be given out to you. But we have upcoming webinars. We have estate planning coming up on October 28th. We have Social Security. Hillary Hatch from Social Security Administration will be going about everything you need to know about Social Security, as well as the series is recorded. The recordings that are on file right now are from 2 years ago. So just a heads up that these are all old and we're refreshing this series as we go. So this Medicare presentation after today is going to get replaced with Michael's presentation. And then the handouts that are being provided are down here below as well. So you'll have access to that resource as well. So with that, I'm going to just give you a little heads up about Michael and his experience. Michael has been licensed since 2019, and prior to joining Voyage Benefits, Michael played a critical part in launching a startup Medicare agency, as well as serving as an independent agent, earning him recognition as one of the top producers. Michael has gained valuable insight into plan design and administration during his time working outside with other carriers. And this experience has provided him the unique perspective that allows him to offer tailored solutions to meet his clients' needs. And I've had the privilege of working with Michael for 5 years. When he's not doing Medicare, he's taking care of his little one. How old is she now, Michael?
3.5. Just
Uh,
started preschool.
Oh my gosh, 3.5 years old.
Yeah,
So he's running
yeah.
after her.
Yep.
But the thing I like about working with Michael and Kelly over at their agency is that they're just great. They're great people, honestly. So with that, I'm going to go ahead and pass the baton over to you, Michael.
Awesome. Thank you. I appreciate the introduction. That was very nice. So let me go ahead and see if I can get this screen share going here. Maybe, is that good? All right, awesome. Well, thank you guys for the opportunity to present to you today. Again, my name is Mike McEntire, and I am with Voyage Benefits here. And today we're just going to be going through what we call our Navigating Medicare webinar. And this is just, kind of designed to kind of take people through those initial stages of the transition to Medicare. We understand obviously that every single Medicare situation is different from the next. No two situations are the same as far as retirement goes or that transition to Medicare. And so we're going to be providing some detailed information, but also pretty generalized or generic to kind of fit the scope of everybody who's attending today. And of course, afterwards, we will be able to consult on a one-on-one meeting or consultation to really dive deeper into your specific situation and needs. But without further ado, let's kind of jump into this thing. So just really quickly, who are we? Who is Voyage Benefits? So we are a Michigan-based insurance agency here. We are an independent broker. Our office is located right here at 96 and Cascade Road. And our goal is really to help people transition from employer-sponsored coverages or individual healthcare options to Medicare to try to make that transition as simple and as easy as possible. There is so much misinformation and over-information regarding Medicare out there. I know if you've ever, if you've been within a few months of your 65th birthday, I know your email and your voicemails and your physical mailbox absolutely are overflowing with information regarding Medicare. There is a lot of, like I said, there's a lot of confusion and misinformation out there. So my job today and for the future is to help you navigate this in a meaningful and effective way, and really try to provide things in kind of layman's terms here. We can take off all the legal jargon and all the governmental stuff and just kind of get down to the root of it. One of the first things I like to kind of make mention of is the fact that our services are completely cost-free. There is never a fee associated with working with us. There is no obligation to work with our agency. People always ask how it is do we get paid? How do we make our living? And because we are licensed with the state of Michigan and then contracted with all of the several insurance companies that provide these supplemental benefits, those insurance carriers pay us a commission for doing that. So there is no charge out of your pocket on any meeting consultation for years to come. This is what we do for you as a cost-free service.
So Michael, I'm going to stop you right there and ask you
Yes,
a
please.
question.
Yes.
So there's a big healthcare company and they have an office off the eastbound line and they
Oh, yeah.
advertise, get your Medicare advice, right?
Yep.
Here.
Yep.
So if I just went directly to them, would it be cheaper going directly to them versus going through you?
No. No. So we are contracted with that company. I think I know what color they are, and we are a licensed and contracted agent of that company. So whether you go directly to them or work through us, there is no difference to your cost, to your plan, to your benefits. There is no difference at all, outside of the fact that if you go directly to a carrier, their internal salespeople can quite only literally help you choose their options, right? And yes, it's a very popular option, especially in our area, but I can promise you it is not the fit for everybody. And so the idea of working with our team is that we are independent brokers. So we are licensed and contracted with numerous insurance companies, both local, regional, and national. And our job is to really take each and every person's situation and tailor it to what they need. Great question. Thank you. So this is just a really quick look at our team. Again, my name is Mike McEntire. You have Kelly Sarin, who is my partner and the principal here at Voyage Benefits. She did the presentation 2 years ago, and her presentation is currently online there. And then we have a gentleman here by the name of Brian Edelman. He does all of our under 65 insurance. So, a lot of times when we have individuals who are aging into Medicare, they may have a younger spouse or even maybe some dependents or children that need help. And so he helps with all the under 65. And then we have our just absolute superwoman, Kristen King here, who just kind of handles basically anything and everything you throw at her. So if you call our office, you're probably going to get Kristen on the line first, and she will help with scheduling and making sure that you get to the right individual. So just a quick look at our team. So today's agenda, original Medicare. We're going to start from the top here. What is original Medicare? What is being provided by the federal government? What does it cost? What does it cover? More importantly, what does it not cover? And then we're going to talk about what our options are for filling in those gaps and holes as well. We are going to dive into a few details about how things interact with HSAs. I know we have a lot of questions about that. There were some things on the table with the recent legislation that were on the table. They didn't get passed. There's been a lot going on here in Washington, D.C. lately, and as much as we try not to get overly politicized with this, unfortunately, this is a Medicare product. This is federally government funded, and so there are some political ties and things to that. So we will touch on some of those changes or potential changes as well. So kind of starting from the top, original Medicare, right? When I use that term or that phrase, original Medicare, I am only referring to the components that are being provided by the federal government. And all that consists of is Medicare Part A and Medicare Part B. Everything else that we talk about is all going to be private insurance company related. These are the only two levels that are being provided by the federal government. Now, a couple things about what this is and what it isn't. Number one, Medicare is made eligible primarily to folks who are 65 and older, right? You age into Medicare at age 65. Doesn't mean you need to start Medicare at 65, and we'll talk about that here in a minute, but you do age in and are eligible at 65. There are a couple other subdynamic or populations of individuals who are eligible for Medicare. One of which we see quite often is individuals who are under the age of 65 that may have qualified for disability through the federal government. Those individuals do qualify for Medicare after 24 months of benefits. So I just want to let people know it's not exclusively 65. There are individuals who are eligible as well under 65 in certain situations. Okay. Now, what Medicare is not, there's a lot of misconception about this, and I want to make sure we understand. Number one, Medicare, not free. Now, there are free components of Medicare. There are cost-free components of Medicare, but it is not free. There are cost associations with certain parts of Medicare, and we're going to lay out those costs and talk about that here today. Number two, it is not a family health plan. And I think that is one of the things that most people seem to not understand about it, right? You've gone 64 years of your life on these employer-sponsored coverages where you're covering your spouse and you're covering your children, your dependents. That's not the case with Medicare. Medicare, you have to be qualified and eligible under your own record. It is not a family health plan at all. Number three, Social Security benefits. Although the Social Security Administration is the one who is ultimately administering this Medicare benefit, it is not tied to your retirement benefit. So a lot of people say, well, I want to start Medicare, but I'm not ready to start drawing Social Security. Aren't those one and the same? And there are certain aspects that are tied to Social Security, but for the most part, the answer is no. I have plenty of clients who are drawing Social Security benefits, but they're not on Medicare, or they are on Medicare, but they're not collecting Social Security benefits. So administered by the same folks, two separate benefits completely. Okay. And then lastly, this is the one that always cracks me up every time. Medicare, Medicaid. I know they sound familiar and they're similar, but they are completely and utterly different. Medicare is this federally provided benefit for, again, people typically age 65 and older. Medicaid is a state of Michigan. It's a state government benefit, and that is typically provided to low income individuals and low assets and resources. And so Medicare and Medicaid are two different things. Now, can you have both? Yes. And those people are called dual eligible, right? It means you have both Medicare and Medicaid. And there are specific policies designed for folks who qualify for that dual eligibility. So again, just trying to get some of the terminology straight here before we dive too deep into this thing. All right, so starting off with Medicare Part A, what is it, right? It is referred to as hospital insurance, and I'm going to be honest with you. If I had the ability to change this, I probably would. And what I would like to call it is confinement coverage, right? Because the bottom line is Medicare Part A is going to kick in anytime that we are confined to a physical location. And of course, hospitalization is an example of that, but it's not the only example. Skilled nursing facilities, home health care, hospice for that matter. there are different levels of this confinement. But the bottom line is, if you are confined to a physical location, including inpatient hospitalization, that is when Medicare Part A comes into play. Now, one of the main things to understand about this, it is not covering the medical services that are rendered during that confinement stay. It's not the medical services. You have to look at Part A as more of a room and board type of coverage. It's a facility fees component. It's covering the brick and mortar, the physical location in which you are. It is not the medical services that are provided to you. Now, you can see here a lot of different things about benefit periods and deductibles and copays and dollar amounts and all this crazy stuff. Honestly, I want you to pretty much forget about most of what you see on this screen here, because the bottom line is, when we turn around and we add supplemental benefits to this, it is going to change the dynamic of how you see Part A functioning in this regard. So don't get overly tied up in benefit periods and deductibles and copays. The likelihood is that it's going to change when we add a supplemental benefit. Now, for most people, Medicare Part A is one of those cost-free or premium-free pieces of Medicare. As long as you have worked, either you or your spouse have worked for 10 years or 40 quarters in the country, you have now qualified for this premium-free Medicare Part A. So most folks qualify for that, and they do not pay a Medicare Part A premium. Now, Medicare Part B. Medicare Part B is really truly the meat and potatoes of original Medicare, okay? This is going to cover all of the medical services that are rendered. Inpatient, outpatient, everything from from preventative to routine to diagnostic testing procedures. The vast majority of items are going to get covered under Medicare Part B. This is the bulk of it. Now, of course, when it comes to Medicare Part B, it is not going to have that same premium-free dynamic that we have with original Medicare Part A. Medicare Part B does cost something. It has an annual deductible. Now, these figures that I'm presenting today, of course, are still based on 2025. They are subject to change and will change for 2026. There's no question about that. The question is just going to be, what do they change to? And I typically don't get that information from the federal government until typically the middle to end of November. So we're out a little bit yet from finding out what those new numbers are. But if I was a betting man, I'm going to say it's going up. It's going up a little bit, right? Our deductible typically goes up. Our Part B premium typically goes up. The question is just going to be, how much is it going to climb? And we're going to talk about that premium here in just a second on the next slide. But what I want you to understand about original Medicare Part B is this. You have an 80-20 split. If you're on original Medicare A and B with no supplemental, you need to look at your original federal government benefit of A and B as an 80-20 split. 80% Medicare, 20% you. Now, the trouble with that 20% is the fact that, unlike the employer-sponsored coverages that you've had your entire working life, this original Medicare benefit of A and B does not, I repeat, does not have a max out of pocket. There is no cap, there is no limit, there is no annual maximum or ceiling set to that 20%. You are quite literally on the hook for 20% forever and ever. And of course, as you can, I hopefully tell, that could be a very, very catastrophic scenario financially. And this is one of the main reasons as to why we cannot just stay on original Medicare A and B on its own. We have to supplement this in one way or another, and we're going to talk about that. But that is kind of what original Medicare A and B is covering. Now, let's talk about the premium associated with Part B. Now, this gets a little confusing, so I want to make sure we understand this. The chart that you're looking at right now is a 2025 Part B premium chart. This only applies to individuals who are either actively enrolled in Part B of this year or are still planning on actively enrolling in Part B this year. Now, this is what they're doing. Every single year that you are actively enrolled in Medicare Part B, your monthly premium is being redetermined or reevaluated on an annual basis. And the way that they're doing this is they are going and they are talking to the IRS on your behalf. They are calling up the IRS and they are asking them, what was this individual's income from 2 years prior? 2 years prior. So in 2025, they're looking at your 2023 income. Next year in 26, they're going to look back at your 2024 income. So every single year, it's this continuous 2-year look back. Not a sum of 2 years, just looking back 2 years. Okay. And what are they looking at? Well, they are looking at what we call your adjusted gross income. Okay. If you look at line 11 of your 1040, which is your completed tax filing, you will look at line 11, which is your AGI. If you file individually, you can see that column on the left. If you file a joint return, you see that column on the right. The bottom line here is your Part B and potentially Part D premiums can and will be affected by a higher income earning. Okay, so if you're under 106, if you file individually, under 212 if it's joint, then you're okay. You're at Medicare's base rate. The base rate premium for this year, 2025, is $185 per month. Okay, now as you can see, that number goes up pretty quickly depending on your income. Okay, and people always ask me two things. Number one, how do I pay this? And number two, is there a way to appeal this or reduce this amount? We're going to talk about that appeal here in just a minute. But as far as the payment goes, it's pretty simple. If you are drawing, you're collecting Social Security benefits, then the federal government makes it easy on you and they just automatically deduct that right from your Social Security check on a monthly basis. There's no need to send you that money, so you can turn around and send it back to them. So if you're drawing and collecting, they're just going to automatically deduct. But again, I have a lot of individuals who start Medicare at 65, but they might not plan to draw retirement benefits if Melissa told them not to till 70 for that matter, right? And so in that case, for that time being, the federal government is going to have to bill you or invoice you your Medicare Part B premium. And they typically do this in a quarterly fashion. And then we have some options there. We can pay that in a quarterly fashion, or we can set up what is called Medicare Easy Pay. And this actually kind of sets up this monthly auto draft, kind of set it and forget it. Don't have to worry about it. Don't have to get the quarterly invoice in the mail. So there are alternatives to payment until that Social Security benefit does begin. Okay. Yeah. Now, what we're talking about, go ahead. Go ahead.
Oh, I just wanted to add something. This is where I don't think a lot of people think about the correlation between Medicare and their financial advisor. But sure. Your financial advisor, there are strategies like, for example, capital gains. If they sell some of your investments and harvest capital gains, that can increase these numbers here and can increase your Medicare premiums. If they're going to do Roth conversions for you, where they're moving money from an IRA to a Roth IRA, that can increase your income. I've had clients who are selling their business and they sell their business, and then 2 years later, their Medicare premiums are astronomical, and they forgot that this was gonna happen. So I just wanted to mention that there really is a correlation between your financial plan and your financial advisor and your cost of Medicare. And hopefully your advisor is being cognizant of the strategies that they're doing and how they can affect your Medicare premiums.
Yes. And my personal example of that is my dad. He sold a income producing property. He sold a second house, and he was ready to make the transition to Medicare. And we looked at it, and he goes, "Whoa, that's going to be a huge jump in Part B premiums." And I said, "Yeah, it is." So what we ended up doing is we held him off. We waited. He stayed working 6 extra months than he wanted to, but he remained on that group coverage just to get him outside of that window, so that those capital gains did not end up having an effect on that Part B premium. So yes, there is a strategy behind this, if at all possible. Now, obviously, there's not always a way to strategize it, but we try our best.
Yeah, exactly. And your financial advisor should be doing that too. So we do have a question here. It is, how is the 257 on the previous slide related to these premiums?
So the 257 is not related to the premium. That is Medicare Part B's annual deductible. So before the 80-20 split occurs, and maybe I didn't do a good enough job of explaining this, before you get to Medicare's 80-20 split, you do have to meet that annual 257 deductible first. That's an annual deductible before the 80-20 split occurs, but it does not have any effect on these premiums at all.
Okay, thank you.
Now, what this chart is called, anything below that first line there, right? This is what we call IRMAA, IRMAA, IRMAA. It stands for Income Related Monthly Adjustment Amount, right? Basically, what they're doing is they are based on your income, they are increasing or adjusting that monthly Part B premium. Now, there are several situations in which we can appeal this process, right? Because a lot of times, let's say that you're retiring at the end of 2025 and you're making your transition to Medicare for 26. Well, if they're going to go back and look at your 24 income when you were still working and potentially a high income producer, you're not making now in 26 what you were making in 24 due to the retirement, right? So basically what we're having here is what we call a life-changing event. And this life-changing event of a work stoppage, a retirement, a work reduction, maybe a divorce or a death of a spouse, whatever have you, if you have a life-changing event to where the current year's income is slated to be less than it was 2 years ago, then we can potentially file what we call an IRMA appeal. We can say, hey, please do not use my income from 2 years ago when I was making this. Use my current year income, which I'm now making here. And they're going to adjust and lower or remove that IRMA surcharge from you for doing so. Now, the trouble with this is this is a yearly process. So with a lot of my clients in this boat, we end up doing this 2 back-to-back years, right? We have to appeal them so far outside of that window to where their natural year's income doesn't affect anymore, right? We have to appeal that down kind of in a 2-year process. But I do want people to understand that there is an appeal process that is available for Medicare Part B IRMA. You just have to qualify for certain life-changing events. And again, this is something that myself and our team would be happy to help you navigate. All right, now continuing on with this original Medicare benefit, right? We already told you that you have a 20% coinsurance with no max out of pocket, no cap or limit. Now, of course, that is the biggest and most concerning piece of original Medicare as far as the gaps and holes are concerned. But unfortunately, it's not the only gap and hole. And we'll find out pretty quickly here that original Medicare is missing several other components: dental, vision, hearing, outpatient prescription drug coverage, international or foreign travel benefits, long-term care. There are a lot of things that the original Medicare system just does not cover. And this is where we have to now use our supplemental tools to help us fill in those gaps and holes. And these gaps and holes are going to be filled in one of 2 ways. And we're going to talk about that here as the day goes on. But I want you to understand that this original Medicare system on its own simply is not enough. It simply is not enough. The dental, vision, hearing, and drug benefits are some of the most important pieces of all this. And even when it comes to the drug benefit, you can actually be penalized for a lifetime if you don't get drug coverage. So we need to make sure that we talk about those benefits. So this is the biggest question I always get. Do I actually need to take this, right? Am I required to enroll in Medicare? There is so much confusion and misinformation out there about signing up and when you have to do it and do I have to do it? And so I know there's a lot of words on the screen here and it's probably overkill, but I kind of want to make sure that I express exactly what we're talking about here, okay? Here's the bottom line. You can choose to delay enrollment into Medicare A and or B at 65 without any risk of penalty if you or your spouse are still actively working and covered under an employer-sponsored plan, and that employer-sponsored plan must meet Medicare's credibility standards, and that is typically met if that employer has more than 20 employees. So if it's a large group employer of more than 20 employees, 9 times out of 10, that coverage is going to meet Medicare's credibility standard, and it would allow you to delay certain or all aspects of Medicare without any risk of penalty. Okay. Several clients of mine have not even started Medicare until well into their 70s because they continued active employment, either them or their spouse, right? And so the decision always comes down to, well, I'm still working, I'm eligible for my employer benefit, I'm turning 65, I'm now eligible for Medicare. Which one do I take? Right? Which one do I take? And that really comes down to a decision about which one is more financially suitable, right? Which one offers and provides better costs and benefits for the more bang for your buck, right? And so we're gonna work with you to make a decision as to which option is most suitable for you and your needs. But the bottom line is you do not have to start at 65 if you're still working and on an employer-sponsored plan.
How do you know if your employer sponsored plan is like credible, right?
Credible.
So
right.
credible just means that it has comparable coverage to what Medicare would provide, correct?
That's right.
Is that what they're
That's
getting
right.
to?
That's right. So the credibility standard that they're looking at is, does this benefit through the employer plan, is it equal to or better than Medicare's benefit, right? If it's equal to or better than, then it meets credibility standards. Now, the eye test is this 20 employee factor, right? But to go one step further, every open enrollment season at your employer, they must provide you with the documentation about Medicare credibility. It's a part of that open enrollment process. They have to give you documentation that states whether or not their policy meets Medicare's credibility standards or not.
Okay. So then you're
Okay.
age 67, let's say, now you're ready to
Yep.
hop on Medicare.
Yep.
How do they know that you aren't going to pay a penalty because you're hopping on at age 67 and you did it at
Right.
65?
Right. Yes, very important. So a lot of people say, hey, well, if I'm turning 65 and I've made the decision to stay on my employer-sponsored coverage and not enroll in Medicare, do I have to go tell them that? And the answer is no. You don't do anything. You just quite simply let your 65th birthday pass by. You don't tell anyone. You don't do anything. There's nothing that has to be done. Now, when you go to apply at 67, for in your example, now we're going to have to provide additional documentation through a different enrollment period. And we're going to talk about that enrollment period here in a handful of slides.
Okay.
Okay.
And are you automatically enrolled in Part A? Because it's free. So are you automatically enrolled in it?
Well, so the only time that you're automatically enrolled in any parts of Medicare is if you are drawing or collecting Social Security benefits prior to the 65th birth month. So for individuals who start drawing at 62, 63, 64, if they're drawing on the way into 65, then the government's going to try to make an assumption for you. And they're going to assume that you're probably not working and that you want to start A and B benefits. And you may not want to. Just because you're drawing benefits doesn't mean that your spouse isn't still working and covering you under their group plan. And so Medicare makes this assumption, and sometimes they're right and sometimes they're wrong. And so we can make a decision as to whether or not we stop that process or allow it to continue. But the only automatic enrollment is due to drawing Social Security benefits prior to 65.
Okay. And why wouldn't you want to, like if Part A is free, why wouldn't you want to just hop
Well,
on Part A?
that leads us right into our next conversation about HSA. Okay. The bottom line is this: health savings accounts. They're very, very popular with employer group plans these days, right? Because we have these high deductible health plans and we have these HSA accounts, right? HSA is a very, very powerful tool. A very powerful tool. It's the three-headed monster as far as retirement, investment goes, right? Money tax deferred going in, gross tax free, pulled out. I mean, it's a three-headed monster. And so there are a lot of individuals who love to be able to continue to make HSA contribution. Now, there's a lot of misconception again about this whole 65 Medicare eligible HSA contribution. How does it work? What can I do and not do? The bottom line is this: as soon as you start Medicare Part A, you have now lost your ability to contribute to an HSA. You've lost that contribution ability. Now, this is one of those things that was it was on the table of the big beautiful bill recently, but it actually got kicked out at the last second. But the rule states as of today, as soon as you start Part A, you have now lost your ability to contribute to that HSA moving forward. Okay. So if you're turning 65 and you still are going to stay on your active employer coverage, you want to continue to stuff those tax deferred funds into your HSA, that three-headed monster, you can do so, but you cannot turn on Medicare Part A. So that would be a reason right there, Melissa, to why you don't, even though Part A is free, doesn't cost you anything, you don't want it, because if you want to continue that HSA contribution, you cannot have it.
Yeah. I think this one trips a lot of people up. So we just
A
want to make you
lot of
aware
people.
of it.
Yes. Now, when you do this, there are some nuances that you have to understand about this too. Let's say you're turning 65, you don't sign up for A, you don't sign up for B, you continue to work, you keep stuffing those HSA funds in there. Now, also too, they have that catch-up rule too, which really allows people to start stuffing some serious dollars in there. But let's say you're doing that, right? When you go to apply for Medicare A and B now down the road at retirement or the loss of that coverage, here's what ends up happening. And this is going to get a little in the weeds, but I'm going to try my best to not make it too complicated. When you go apply for Medicare A and B down the road, we get to make the determination on the Part B effective date, right? So we get to have a requested start date for Part B, which again is the premium based portion, right? We call the shots on when Part B starts. What we don't get to call the shot on is Part A, because Part A is going to automatically go retroactive 6 months. And when that Part A goes retroactive 6 months, and you were contributing HSA funds for the last 6 months, now you have an overlap, right? Now you have a problem. And this is where that HSA contribution in Part A at the same time cause a potential issue with the IRS and some potential penalties. So in a perfect scenario, if we know that we're funding the HSA, we know that we're going to be retiring on such and such a date, we can do ourselves a favor and stop that HSA contribution 6 months in advance, so that when that Part A comes back 6 months, they don't overlap. They butt up against each other, right? So
and there's
again,
equation too, like if you retired in July, you were only eligible to make like 6 months worth of contributions, right? So so there's some math and some calculations that go into that. And so either your advisor should be, a financial advisor should be helping walk you through that, or Mike's team can help you walk you through that. But if you have an HSA and you're not enrolling in Medicare at age 65, there's some nuances and you just need to be aware of them, and you can get help and support in figuring out, when do I have to stop making contributions and how much am I allowed to contribute this year?
Right. But I can tell you with conviction here that a lot of folks who have the opportunity to move to Medicare at 65 don't do it because they still want this contribution into HSA, right? If you're going to plan on working for 2-3 more years post 65, why would you not want to take advantage of that HSA three-headed monster for as long as you can? So there's ways to do it. You just got to try to do it the right way to avoid any sort of penalty.
And when you say three-headed monster, it's because money goes in tax-free, it grows tax-free, and as long as it's used for medical expenses, it comes out tax-free. That's our three-headed monster right there. It's a great account. It's my favorite account.
Yeah, absolutely. It's a powerful tool. It's a very powerful tool. So again, that might be a reason as to why somebody does not want to sign up for Part A, even though it's free at 65. If you take it, you lost your ability to contribute. Okay. So moving on, enrollment periods. Let's talk a little bit about enrollment periods. I'm gonna work my way through some of this because yes, it's important, but again, it's very nuanced and it depends on your situation. I want to make sure that we get to the bulk of the presentation, which is the comparison of Medicare Advantage and Medicare Supplement. So I'll kind of work through this quick. This one we already talked about, automatic enrollment. Only time you're automatically enrolled into Medicare A and B is if you are drawing Social Security or collecting that benefit prior to age 65. If that's the case, they're going to automatically make an assumption. They're going to enroll you in A and B. They're going to send your paper red, white, and blue fancy ID card in the mail. We then have a decision to make. Do we hang on to it? Are we making this transition now? Or are we putting it back in an envelope and sending it back to the government and saying, thanks, but no thanks, I'm staying on a group plan right now? So we'll have to make that decision if that's your situation. Now, this is the one that is mostly talked about. This is called your initial enrollment period. This is the one that gets everybody fired up and in a frenzy because they feel like they have to sign up during this window. It's a 7-month window around your 65th birth month. 3 months before, the month of, and the 3 months following. Now, I want to throw this out there too, because this trips people up as well. If you are born on the 1st of the month, this whole window shifts back a month. You actually become eligible for Medicare 1 full month early, the first day of the previous month, only if you're born on the 1st. If you're born anywhere from the 2nd to the 31st, then it's the first day of your 65th. But this 7-month window is around your 65th birth month. And the importance of this is twofold. Number one, if we apply during any of these 7 months, you are not technically late to enrolling into Medicare, and you cannot be penalized at all during this 7-month window. But what's more important about this is the day in which we submit the Medicare application during this 7-month window actually indicates and dictates your start date. So depending on when we need it to start, it depends on when we submit the enrollment. If you do it in any of the first 3 months before your 65th, well, then it becomes effective on the first day of your 65th. But if you do it in the 65th or any of the 3 following, it becomes effective on the first of the next month. So again, depending on your timing and your scenario, it might indicate when we actually press the button as far as the enrollment process goes, because it will indicate and dictate your start date. And one of the things that we want to make sure that we're trying to do is we're trying, no matter what it is, no matter what enrollment period we use or what behind the scenes scenario we're doing, what we're trying to do is set up a seamless transition, right? A seamless transition. No gaps, no holes, no uninsured days, right? Insurance ends this day, Medicare starts the very next day. No gaps and holes.
I usually tell people before they turn 65, about 3 months before 65, to just meet with a licensed Medicare agent to consider like, should I stay on my employer plan if I'm going to keep working, or should I switch over to Medicare? Because we do find sometimes that Medicare is providing better coverage than their employer plan has.
Oh, absolutely.
And so it depends on the employer. And then I usually tell them too, so they decided to stay on their employer plan. Now they're 67 and they're planning to retire. I always use kind of like the 3 months before you pull the retirement trigger to like meet with your Medicare agent to tee up and make sure that you have a smooth transition. Do you think that's an appropriate time frame, Michael?
Absolutely, absolutely. 3 months, because the bottom line is the federal government won't allow you to do anything even 1 day prior to that 3 month window. Like we have to wait right until that 3 month window. So whether it's at 65 that we're making the transition, whether it's at 68 that we're making the transition off of a group plan, 3 months is the magic number. Yes. Yep, that's perfect. Now, this is the window that we're talking about that quite honestly is getting utilized more frequently now than almost anything. And this is just what we call a special enrollment period. And this is utilized for people who chose to delay their enrollment in Medicare at age 65 because they were still working or had access to an employer-sponsored coverage, maybe through their employer or their spouse's employer, right? And so the bottom line here again is the federal government gives you time to get this done without issue of penalty. They give you 8 months to get it done without issue of penalty. So penalty is not our concern with this. What our concern is that seamless transition, right? I don't want my client to have one uninsured day, because of course that's the day where something happens, right? So the idea here is, yes, they give you 8 months to get the job done, but it's really not 8 months. We want to make sure that we do this in a timely fashion, like Melissa said, about 3 months before that loss of coverage. We want to start making, our game plan, submitting enrollment applications, because you guys, we are dealing with the federal government here. This is a slow process. This is not just flip the switch overnight type thing. It takes several weeks sometimes for things to process through. So the more time that we give somebody, the better. Now, if I had to put out a couple fires and do some fire drills lately where somebody calls me and they say, I just lost coverage today, or I'm losing coverage next week, it's like, okay, well, we better get moving. So, we're going to try our best to handle your situation as it presents itself, of course. But in a perfect scenario, you give us a little bit of heads up, and that 2 to 3 month window is what we're looking for sure. So these, you don't need to worry about this too much. This is just showing the documentation that we would utilize. And Melissa asked the question before, hey, if I'm going to stay on my employer coverage and I'm going to wait a few years to transition to Medicare, I don't have to tell the federal government I'm doing that now. What has to happen when I go to do it? And that document that you're looking at on the right there, that request for employment information, that is our ticket. That document right there, we would provide to you. You would take it to the HR department. They would fill that out for us, and that's going to act as your permission slip or your proof that from 65 until now, whenever now is, right? Could be 5 years down the road, who knows? From during that window, you were credibly covered by your employer-sponsored plan. And we fill one of these out for every person, you and your spouse, if they were covered under the plan. So that right there is a very important piece of documentation, and of course we would walk you through that process at that time. All right, let's dive into some of this extra stuff. I want to talk about the drug coverage. I want to talk about Medicare Advantage and Medicare Supplement. I want to talk about the different options that we're going to have available to us for filling in these gaps and holes. Let's start with the drug coverage. Medicare prescription drug coverage. This has changed dramatically in the last year. There's been a lot of changes. A lot of it's due to what we call the Inflation Reduction Act, and it's really changed the name of the game for Medicare Part D drug plans. If anybody used to hear about this thing called the donut hole or the coverage gap, I know that donut hole phrase gets thrown around a lot still. It is done. It is gone. It ceases to exist. It's not a thing anymore, okay? What we now have with Medicare Part D, due to the Inflation Reduction Act, is really 3 different phases or levels of coverage. Level number 1, deductible phase, right? On the deductible phase, you're paying 100% of your meds until that deductible is met. And the deductible just depends on the plan. For this year, it could be as high as $590, but that is capped at that amount. But it could be lesser, it could be up to that amount. It just depends on the plan that we choose. Once the deductible is met, then you jump into the initial coverage phase, that middle column there. What's important about initial coverage is this. The cost that you now pay for your prescription meds during this phase is 100% dependent on what tier that drug or that medication is covered by that plan. And that depends on the company that we choose. The drug companies, they get to choose the level of tier in which the med's covered. And to be honest with you, they get to decide whether or not that medication is covered or not. You may find that your medication is covered by carrier A and B, but not by C, D, and E. And then with carrier A and B who covers it, one might cover it as a tier 3, the other might cover it as a tier 4. That can be a significant difference in cost. So this is why it's really crucial to have a licensed agent like myself or anybody else in the area take a look at this stuff for you and help you decide as to which drug plan is going to be most cost effective for you for that year. Now, the good news is we get to change this drug plan every single year. And I'm sweating bullets already thinking about it because it's right around the corner. October 15th to December 7th is coming up, and that is our window of a period every single year in which we get to review and change that drug plan if need be. Okay, but the bottom line is this. After initial coverage, you are done. This is the new thing. This is where the donut hole used to exist, and now it's gone. At $2,000, you are done. If you spend $2,000 in out-of-pocket costs on your prescription meds, you are done. You now move into catastrophic, and now 100% of your medications are now covered for the remainder of the year. Now, that number is changing ever so slightly for next year. They're bumping it up by a whopping $100. It's $2,100 for next year's limit. But again, $2,000, $2,100, it's wild. It's wild. I have clients of mine who were used to spending $7,000, $8,000 a year in drug costs on the previous method. They're now capped at $2,000. It's a wild thing, but we have to also understand that money doesn't just disappear. It just gets kind of pushed around the table, right? So if the Medicare beneficiary is not the one to pay for it, somebody has to, and it's kind of moved and shifted the weight to the private insurance companies. And with that being said, go ahead.
Do you recommend people review their drug coverage every year just to make sure, like, I'm on this list of medications, and so
Yes.
I just want to make sure that my insurance company is still going to cover those next year?
100%. Because
Okay.
here's what's happening. Because of all these changes that we've seen, and now the drug companies having to pick up for the bulk and the brunt of this cost, that's causing a huge ripple effect. We're seeing drug companies just flat out leave the market. Our options are fewer and far between than they've ever been. There's not a ton of options as there used to be. They're having to cut formularies, which means that they're taking certain medications right off of the list. So what might have been covered last year may not be covered this year. So they're hacking formularies up, and then they're changing the tiers at what co-insurance or copay you have, right? But the bottom line is, whether you're meeting the $2,000 in January or you're not meeting it until October or November, the $2,000 is the $2,000. When you're capped, you're capped. But it is still so important to make sure that drug policy is the right fit for you every year, to make sure that the drugs are on the formulary for sure, and that your pharmacy is in network, all those things.
That makes sense. So I tell people, just like you have your open enrollment period with your employer, and you're looking at the new benefit costs and the plans and making sure, do I want to be on the high deductible plan or the other plan? I tell people to do the same thing during Medicare open enrollment. Reach out to your agent and just be like, is there any big changes I should be aware of? Or should I be making changes to the program I'm in right now?
Yep, absolutely. And in every 4 years election cycle, it seems like those are the years in which we start to tee off some of the biggest changes, as we go through. So this is definitely a year in which we are seeing some ripple effect, and it's as important as ever to have things reviewed for you, for sure. Now, this was one of the really cool things that came out of the Inflation Reduction Act. It's called the Senior Savings Model, and essentially what it did was it came in and it capped all insulins at $35, regardless of what coverage phase you're in. You're capped at $35 on these drugs, regardless. Now, one thing that everybody asks is, well, does that count for my GLP-1 medications? And no, we are talking about insulins, Humalog, Novolog, Chijeho. We are talking about true insulins. It is not the hybrid GLP-1s and things like that. Okay. So let's start talking about, because I know my clock is ticking and I don't have a lot of time left, and I apologize for that, but I hope you will stick around with me here and walk through this with me. If you have to get off, it is recorded and we can view it later. But what I want to do now is I want to start diving into the bulk of this. What are my options for supplemental? We've already talked about the 20% co-insurance with no max, the no drug coverage, the no dental vision hearing, all those gaps and holes. What are the options for filling those in? Well, there's two. There's Medicare Advantage and there's Medigap, also known as Medicare Supplement. We have two different ways of doing this. And they honestly couldn't function more further apart from one another. They are black and white, apples to oranges in comparison. They are two completely different ways of doing this, but we're going to talk about that now. So on the left, we have original Medicare is what you would have to start. I want you to understand that the original Medicare benefit of A and B is required to go with either of these options. Okay, you can't bypass A and B. You can't bypass the Part B premium to get to another option. A and B is your foot in the door. It's your ticket to the dance, if you will. You have to have A and B just to get in. Okay, but on the left hand side here, we have what we call Medicare Advantage. Very, very popular. Very, very trendy. I know you've had to have heard of it because the TV commercials are happening every day as we speak. So it's highly publicized and it's very advertised, right? But here's the idea: a Medicare Advantage plan, when you really take a step back and think about it, it's super similar to what you've always had through employer style coverages. Okay, it is an all-inclusive, privatized, managed care plan. Okay, it functions very similarly to the employer style coverage that you have always had. But what is important to understand about it is that it is a replacement. You are replacing the original Medicare system. Again, doesn't mean you get to bypass it, doesn't mean you get to not enroll in A and B and pay a premium. You still do, but it is replacing it with an all-inclusive option. One card, one plan, one-stop shopping. Your drug coverage is built in. Your dental, vision, hearing benefits are built in. You have an annual max out-of-pocket limit that's built in. So all of the issues that original Medicare presented itself with, this plan has now come in and addressed all of those issues in a one plan replacement plan. Okay. It also includes things like gym memberships and over-the-counter allowances. You know, if you heard your friends talking about they're going to MVP and the YMCA and they have this little card they get to spend at Walgreens or Meijer, they're doing that primarily through a Medicare Advantage option. Okay. And there are several insurance companies and options. Honestly, there's way too many options in my opinion. And that's where I come in to try to help kind of cut through the weeds and get rid of the stuff that we're not interested in, talk about the stuff that we are. But the bottom line is this: it's privatized, which means that it's network affiliated. These are HMO or PPO style network-based plans, very similar to what you've always had through employer-sponsored coverages. Not a lot of difference, right? These plans function on the same chassis that an employer-sponsored coverage does, right? Premium, deductible, cost share, max out of pocket, right? That's kind of how these plans break down. It's very similar to what you're used to today. Now I'm going to come back to this slide in a minute, but I want to talk a little bit about this Medicare Advantage plan here, and then we'll go back. So I want to kind of show you an example of how one of these policies would work. As you see at the top, Medicare Part B premium, like we said, we have to have it, right? $185 or more, depending on your IRMA surcharges, right? But that you're going to pay that base rate. But now you can sign up for this Advantage plan in most cases at a $0 premium. The vast majority of the value-based Advantage plans, in my opinion, are $0 premium. Okay. Now, of course, now they're network restricted, so we have HMO or PPO style plans. And what you're looking at here is just a kind of a simple example of how this would work. You may have a deductible depending on the plan. You're going to have an annual max out of pocket. You're going to have different cost shares or copay structures for all of your services as they're rendered. So each and every service that original Medicare covered, this Advantage plan has to cover too. But now instead of covering it at 20%, you know, at an 80-20 split with no maximum, now they're covered at these predetermined, pre-negotiated flat rate copays or cost shares, and they're all being added up and applied towards the annual max out of pocket limit. You cannot spend anything more than the annual maximum. Bottom line, the max is the max, right? But now again, this plan builds in the drug benefit, the dental, the vision, the hearing, the fitness membership, the over the counter. It's all included. It's all included. Mm-hmm. Go ahead, Melissa.
Oh, I was just gonna say, sometimes I have a client that's gonna get like a hip replacement or a knee replacement. And I'm like, oh, yeah. and they know they're gonna do it like next year or 6 months out or something like that. And I go, well, make sure you talk to your Medicare agent and let them know that, because the plan you're on, there might be a better plan out there for you that will have better coverage for that upcoming procedure, right? It's kind of like not an elective procedure per se, but like you're planning for it in advance.
Yep.
And so there might be a better Medicare Advantage program
Yep.
out there that will have better coverage for that upcoming procedure. So during
Absolutely.
open enrollment timeframe is when you would have to change over, right?
Yep.
October through December,
Yep.
in order to make that change.
Yes, and to piggyback on that too, I think what's interesting is, and there's data to back this up. The first like 12 to 15 months on Medicare is typically the largest claims for Medicare clients, because they kind of postponed a lot of these hips and knees and back surgeries until they were on Medicare, right? Because if they're doing that surgery on their employer sponsored coverage, they may have a 20% cost share and a $4, $5, $6,000 deductible and a $10,000 max. You come over and do that on a Medicare Advantage plan, and you're going to pay $350 for that same surgery. So
Right.
it's funny when people end up kind of postponing or delaying some of these major surgeries and procedures till once they're on Medicare. That's another thing to piggyback on. So this is kind of the idea of a Medicare Advantage plan. Again, it should look very familiar and similar to you because it functions just like what you've always had. It's a privatized version of Medicare is how you need to look at it. Okay.
Yeah. By
Now,
privatized, we mean instead of you going on the Medigap policy where the government's taking care of it, the government is sending money over to the insurance company
yep.
to take care of everything for you, right? Like, okay,
Yes.
you're not on the
Yes.
traditional government program, so they send the money to the insurance company and say, okay, insurance company, you figure out what you're going to cover and not
Yep.
cover for the
Yep.
amount of money we're sending over to you because Joe Smith is not on the traditional government plan. So that's what we
That's
mean
right.
kind of by it being
Yes.
privatized.
Yes. It's and that's the reason that it's a $0 premium to the Medicare beneficiaries, because the federal government is kind of sending those funds over to the private insurance company on your behalf.
Correct. And
And
that's
then
the reason why you're
the
seeing all those advertisements on TV because
right.
the insurance companies want you to
Right.
come to
Zero
them so
dollar
they can get
this and
that money
zero
from the
dollar
government.
that. And
Yeah.
right. And again, there's a lot of value in these plans. It's just about making sure that we choose the right one, because the doctors have to fit the network, the meds have to fit the formulary, the dentist. There are so many little nuances about choosing the right Advantage plan for yourself, and of course your health dynamic plays a major role in this too. And again, this is the idea of meeting with us. But I'll leave it at this for Medicare Advantage. The moral of the story is this: health and longevity is the key. It is your goal, and it is your private health insurance company's goal. The healthier you are, for the longer you are, the less expensive this plan is going to be for you and for your private insurance company. That's the reason they're giving you the gym memberships, the OTC allowances, the dental vision hearing. It's there for their membership to use it and for those benefits to ultimately keep them healthier longer. Okay. So coming back, option number 2, what is our other choice, right? Our other choice is on the right side of the screen here, and it's what we call Medicare Supplement, also known as Medigap. Medigap's kind of the street lingo for it, but basically the idea here is this. Folks who choose to stay on this option, they are not replacing the original Medicare system with an all-inclusive privatized option. What they're doing is they're choosing to keep themselves on the original Medicare system of A and B. And they're going to meet that 257 deductible that Part B has, and they're going to let Medicare pick up 80% of all of those remaining costs and services after the deductible. But then there's that pesky 20% that's left there, right? With no limit, right? So what we do now is we go out and we purchase what we call the Medicare Supplement, or also known as a Medigap policy. And this policy has one job and one job only. And the only job of the Medigap plan is to be a claims payer. It's there to cover and offset that 20% coinsurance that Medicare left behind. Now, of course, the question ought to be, how much of that 20% is this Medigap plan covering? And of course, that depends on the Medigap plan that we select. And just like anything, there's way too many options. And I'll tell you which ones I recommend and which ones I don't, what carriers I recommend and which ones I don't, and my reasons why. But if we choose the right Medigap plan, it quite literally might pay 100% of that 20% that Medicare left behind. So by the time that Medicare covers their 80 and your Medigap covers your 20, what are you left with? Nothing, zilch, nada for medical, right? So it can be a very powerful tool, but it's going to come at a premium. And we're going to talk about that here in just a minute. You're paying for this. It's not premium free like the Advantage plan was, mind you, right? But when you really take a step back and you look at these two options from a high level perspective, you have Medicare Advantages, which is basically a don't pay now and only pay later, because you're only paying at time of service. Whereas Medigap is the opposite. It's only pay now and premium and don't pay later, because Medicare and the Medigap is covering that. Now, the trouble with it is this: everything now becomes an a la carte standalone product. So I kind of make this joke that if we go this route, we're going to have to buy you a new wallet too by the time we're all said and done here, because you're going to carry around 4 or 5 different ID cards. You're going to have your original Medicare card for the 80%. You're going to have your Medigap card for the 20%. You're going to have a Part D standalone drug plan card for the pharmacy. You may even have a dental and a vision card. So it's not this all-inclusive, cute little product like Medicare Advantage is where it's all built in. Everything is truly an a la carte and standalone option, right? We're kind of piecemealing and building our full coverage option here, okay? Let's take a little bit of a look about how something like this would function. Like we said, you meet the 257 deductible, Medicare comes in and grabs the 80%. Now, Medicare sees that you have a Medigap policy on file, and instead of billing or invoicing you personally for the remaining 20%, they send that over to your Medigap company, right? And depending on that plan, what letter plan it is, they're going to cover a percentage or all of that 20%. And so what you're seeing here on the right is an example of a Medigap Plan G. Plan G is on paper the most comprehensive policy available. It's not always the most recommended, and we can talk about that offline, but Plan G on paper is the kind of the top dog coverage. So here's an example. You pay your $185 for Part B, you pay a supplemental or Medigap premium, we'll call it $140. You have to add a Part D drug plan, let's call it $25. There's no network restriction, there's no limitation. You show up where you want, when you want, to see who you want, anywhere in the country, as long as they're Medicare accepting, you're good to go. No
Right.
network affiliation, right? That's that
Right.
flexibility and freedom dynamic that you didn't have with Medicare Advantage. But now
So
you
I've had that
need
before, where
Yep, go ahead.
if you chose an Advantage plan and you wanted to do a consult at Mayo or the Cleveland Clinic, and your Advantage plan that's not in network for them,
Yep.
you would have to pay for that out of pocket.
100%.
Versus if Mayo Clinic or Cleveland Clinic, if they accept Medicare, you're in.
Yep.
It's in network, right?
Yep. Easy peasy. It really is. I can tell you this. Over the course of the last several years, Medicare Advantage plans have continued to get stronger and stronger and stronger, meaning their networks are getting larger, more broad, more expansive. So the network dynamic is starting to become a fewer and far between actual issue or concern with a Medicare Advantage. But the bottom line is this: from a provider, a doctor, or a hospital's perspective, yeah, they kind of like to see original Medicare and a Medigap, right? Because it's just they know they're going to bill Medicare, they're going to get paid, they don't have to worry about network concerns or issues, they don't have to file for prior authorizations or anything. It just kind of works, And so there is a little bit of a flexibility and freedom dynamic with the original Medicare and a Medigap option over that of a Medicare Advantage. But again, I'm going to be honest, that line is starting to get really tight there, because again, these Advantage plans just continue to get stronger. They just continue to expand their networks and their abilities to doctor outside of the state and things like that. But yes. So taking a look at this example here real quick. In this instance, you pay your monthly premiums, you have that annual $257 deductible, but as you can see there, after that, everything is covered at 100%. There's no more copay costs, there's no max out of pocket, there's no cost share. Medicare's covering 80 and your Medigap's covering the 20. But as you can see, they're highlighted in red. No drug coverage, no OTC. Sometimes there's health memberships, not always, depending on the company. But everything is now an a la carte standalone product. So we're buying everything standalone, hence the new wallet concept.
Yeah. So even if you chose a Medigap plan, like the G plan
Yeah.
that you're talking about, the Medigap G plan, you would
Yep.
still need to you would still potentially shop your Part D drug coverage every year to make sure it's the proper
Yes.
drug coverage for you.
Yes.
Okay.
Yes. The Medigap policy is something we're more going to kind of set and forget, right? We're going to buy it one time. We're going to get into it. We're going to kind of pay the premium and set it and forget it. The Medicare Part D drug plan, we cannot set it and forget it. We have to review that annually, and we have that yearly chance from October 15th to December 7th to do that. Now, let's do a little bit of a side-by-side here, a little bit of a comparison of these two options, right? When it comes to the providers, right, like we said, a Medicare Advantage policy is a network affiliated plan. So we do have to make sure that your providers that you want to see and continue to want to see are going to be accepted in that network. And that's why we typically lean more towards PPO products over HMO products, because of the flexibility and freedom. Whereas on the Medigap side, again, there is no network. There is no private network to worry about. You show up where you want, when you want, to see who you want, anywhere in the country. We're not concerned about networks. Okay. Now, this next piece, stay with me on this. This is super important to understand. On the Medicare Advantage side, you may change your plan every single year. during open enrollment from October 15th to December 7th. You will never have underwriting. Your pre-existing conditions will never play a role in your eligibility. You can quite literally change that plan every single year for no reason or any reason at all. As your health changes, as the plans change, as the benefits change, we can quite literally change that right along with you. But look on the other side, Medigap, not the story. So here's how it works on Medigap. The first 6-month window on Medicare Part B, so whenever you turn Part B on, could be at 65, could be at 68, just depends. When we turn on Part B, you start a timer, and that timer only ticks for 6 months. And what that means is during that first 6-month window on Part B, this is what we call your Medigap open enrollment or guaranteed issue window. We call it the golden ticket, right? During that 6-month first period on Medicare Part B, you have a golden ticket. And you can turn that in for a Medigap policy as a guaranteed issue applicant, meaning no medical underwriting or questions or pre-existing conditions can play any role in your approval or denial or in your rate. Your premium rate cannot be affected by that at that point. But here's the kicker. I said that timer only ticks for 6 months. And when it goes ding at 6 months and you are now outside of your first 6 months on Part B, you have now lost your golden ticket, whether you used it or not. And you now have to go through medical underwriting if you want to now apply for a Medigap. So here's 2 examples. Maybe you started on Medicare Advantage and a year down the road, you want to go to Medigap. 6 months is over, underwriting. Or let's say you did use your Medicare, your golden ticket, and you went with Medigap out of the gate. But let's say you picked a company that Mike didn't recommend and the rate went through the roof. And now you want to switch to a different Medigap plan. Same thing applies. Your golden ticket's now been used, it's gone, and you're now subject to medical underwriting when you go to move. And medical underwriting can be a little bit of a pain, right? These insurance companies are going to ask you to attest to a laundry list of health questions, sometimes going back 5 or 10 years. And they're going to look at your medical records and make a decision. How much adverse risk are you bringing on, right? Do they financially want you on their boat or not, right? And they get to kind of decide whether or not you're gonna be accepted or denied. So the bottom line is this: Advantage, never any of that stuff. You can change and add it every year. Medigap, the first 6 months are guaranteed, but outside of that, very limited guarantees after that. Okay, prescriptions. Like we said, if we go the Medicare Advantage route, it's all inclusive, it's built in. So your Part D drug plan is built right into the plan. Nothing to do, it's just built right in. But on that Medigap, it's all a la carte and standalone, right? New wallet concept. So we have to add that Part D drug plan as a standalone or a la carte product. Cost of insurance. Like we said before, Advantage, typically 0 premium. So you don't, very low to no premium, but now you're paying for costs as you go. Whereas the other side, Medigap, it's the opposite. We are paying a premium, right? And that premium is subject to rise every single year. And here's where, and Melissa, maybe you and I should talk about this a little bit too offline here, is the increase on Medigap in the last year or so has really skyrocketed. And I don't see a light at the end of the tunnel for that. In years past, we kind of figured a 3 to 6% annual rate increase. Those now are looking like 10 to 12, sometimes 15% rate increase on Medigap. It's going through the roof.
The hard part is more and more people choose Medicare Advantage. If they choose Medicare Advantage, there's less people in the pool for the Medigap. It's an insurance, right? So the more people, they can spread out the cost. So that's what's happening.
100%. And on top of that, utilization is up. Healthcare costs are up. Yeah. Everything is going up. And like you said, there are fewer and fewer bodies that are going into Medigap. And they need that young, healthy 65-year-old applicants coming in. Well, if all of those people are going to Medicare Advantage, then the Medigap plans are just getting older and sicker. And so it's causing these rate increases. So anyway, something to talk about. Coverage, like we said, on the Medicare Advantage, you're now going to pay co-pays and co-insurances for all medical services provided, but all being added up and applied towards that annual max out-of-pocket limit. Once the max is met, and you're done. On the other side, Medigap, this is where we're going to pay the premium, but now your balances that are left over are now going to be covered between Medicare and the Medigap. So your out-of-pocket exposure gets dramatically lessened, or actually, all in all, eliminated, right, in certain circumstances, okay? And then last but not least, primary payer. the Medicare Advantage plan becomes the only payer. Like I said, we replaced original Medicare. So the Advantage plan is your only and primary payer. Whereas on Medigap, it's different. A and B, the original federal government benefit, still acting as the primary payer, and the Medigap becomes the secondary claim processor to come in and pay what's left. Okay, so again, just a kind of a high level overview of those two products. As I mentioned before, and I know I'm way over on time, so I'll wrap it up, but we do offer individual options here at Voyage Benefits as well. Like we said, early retirees, not yet eligible for Medicare, younger spouses or dependents that are under age 65. We have options for you there as well. We can compare those cost options versus things like Cobra. Our job is to kind of help you navigate every transition that you may have. Okay. And that's what I got. So thank you all for your time. I hope you grabbed something out of that and learned something new. Please feel free to reach out to myself or my team here. Phone number, email, website on the screen. We're more than happy to assist you in any way that we can. And again, absolutely cost-free consultations from A to Z. So
I know we run long every year, Mike. I forget that.
I know.
Really let everyone know that this is like an hour and 15-minute presentation. So
I can't get it done in 60 minutes. I'm sorry. I can't.
Well, that was wonderful information. I would be impressed if you could do that in 60 minutes. So I still think you did a great job. But thank you, Melissa and Michael. We really appreciate you taking this time to share this information with our alums. And thanks to everyone who joined us today. Keep an eye out for those follow-up emails with additional resources. And then we always have upcoming webinars, including our monthly Retire Well series, our Financial Sense series, and more. So look for those emails, check out the Alumni Relations website, and thanks so much. Go Lakers.
Awesome. Thank you.